Hello, my name is Katarina McKenzie, and today I will be discussing the topic of neighborhood factors in child sleep problems and the policy implications that result from my findings. Sleep problems include bedtime difficulties, night wakings, and poor or excessive sleep duration. The study of child sleep problems is important because they are associated with behavioral problems, poor school performance, and poor physical and mental health, and are implicated broadly in child development. This makes them a key performance indicator of overall health. Interestingly, a study by Quash and colleagues from Australia estimated that child sleep problems costed their federal government $27.5 million in direct healthcare costs, which is roughly $25.7 million Canadian. Although there is no current study looking at the effect on the Canadian healthcare system, Australia is similar socio-demographically to Canada and can give us a rough idea of the effects of sleep problems in children economically. Applying Bronfenbrenner's social ecological model to sleep problems would suggest sleep problems are influenced by varying psychosocial and environmental aspects from the family, school, and neighborhood a child lives. These levels interact with each other to influence child development. Previous research has identified a number of child and family level risk factors related to child sleep problems, and I've listed the important child level factors and family level factors I controlled for in my current study. I'm happy to give more detail as to their inclusion or the findings that resulted in my question period, but the primary focus of my presentation is on neighborhood level factors. Less research has examined the effects of neighborhood level factors in child sleep problems. Previous research has noted some important risk factors to control for at this level as well, which I also included in my models. Of particular interest in my study is the measurement of socioeconomic characteristics, or SEC, which can be measured at different levels of the social ecological model. Family level SEC has been identified as a well-established risk factor for child sleep problems, where low SEC families appear to have a higher rate of their children having sleep problems in comparison to higher SEC families. My study will focus on education level and income at the family level. As for neighborhood level socioeconomic characteristics, higher neighborhood level poverty has been associated with increased sleep problems for children. No study to date has investigated the interaction between family level and neighborhood level SEC, which is what I completed in my study. The interaction between the two identifies the relative economic position of a family in relation to the neighborhood they live. For example, a low-income family would have relative deprivation if the families in the neighborhood they lived were more affluent. Relative economic position has been examined in relationship to child mental health problems, but not sleep. Boyle and colleagues found higher levels of mental health problems in children with relative deprivation. So low-income families living in neighborhoods with higher income families had higher levels of mental health problems than low-income families living in neighborhoods with predominantly low-income families. We predicted this finding would extend to child sleep problems. So the primary objective of my study was to look at the relative and interactive effects of family and neighborhood level SEC above and beyond well-established risk factors that I briefly mentioned earlier. So my first hypothesis was that neighborhood level poverty would be significantly related to child sleep problems above and beyond these control variables. I also hypothesized an interaction effect between family level and neighborhood level poverty, where children with relative disparity would have higher levels of sleep problems than children without relative disparity. So for example, children from families with lower incomes relative to their neighborhood. To do this, I completed a secondary data analysis of the 2014 Ontario Child Health Study, or the OAKS. So the OAKS is a cross-sectional province-wide probability sample of over 10,000 children aged 4 to 17, and it used a sampling plan based on the Canada Child Tax Benefit file. The OAKS used dissemination areas to link data from the 2011 Canadian Census on the characteristics of the neighborhoods of participating families, such as the amount of poverty in those neighborhoods. Data were linked at the dissemination area, which is similar to a postal code, and the smallest unit of geography collected by Statistics Canada. We selected this level of analysis to capture the most proximal neighborhood characteristics to children and youth. To assess sleep problems, I used data collected from a PMK, or person most knowledgeable, and youth on problems falling asleep and problems staying asleep. The problem staying asleep variable is the sum of night wakings and problems falling back to sleep after a night waking. I also analyzed data on children's sleep durations for weekdays and weekends, and this is based on reported weekday and weekend bedtimes and wake times. For the socioeconomic characteristics variables, the low-income measure was used, and it is a measure of relative poverty. The low-income measure uses a cutoff calculated by taking 50% of the median equivalent household income over the population of individuals, and this was taken from the 2011 Canadian Census. It's also adjusted for household size. Neighborhood-level poverty was the percentage of families in each neighborhood that fell below that cutoff, and for family-level income, families' incomes were coded as above or below this low-income measure, and this was based on PMK reports of their income taken from the 2014 OAKS. The cross-level interaction between neighborhood poverty and family-level income was used to test the relationship of relative deprivation and child sleep problems. So to test my hypotheses, I ran multi-level regression models as children were nested within families and neighborhoods in the sampling design. I also applied sampling weights based on the probability of being selected and participating in the study, and these were created by Statistics Canada and applied to children at the family level and between neighborhoods. So this is just a brief overview of all the variables included in the models and the level at which they appeared. Starting with the results for the child data, the problems staying asleep and problems falling asleep outcomes, none of the variables of interest were significant. And for weekday sleep duration, higher levels of neighborhood poverty predicted significantly lower sleep duration on weekdays, above and beyond the child, family, and neighborhood level control variables. And finally, for the weekend sleep duration, a significant interaction effect was found between family level income and neighborhood level poverty. So the interaction effect showed low-income families living in neighborhoods with low levels of neighborhood poverty slept the longest, while the shortest sleep durations belonged to higher income individuals living in neighborhoods with low levels of poverty. However, upon probing this interaction, I found the simple slopes of each line were non-significant and therefore did not differ from zero. For the results of the youth data, the models showed problems staying asleep was significantly predicted by higher levels of neighborhood poverty and incomes below the low income cutoff, while the other sleep outcomes showed no significant predictive relationships with the variables of interest. So overall, the results of my study only partially supported my hypothesis that neighborhood-level poverty would be significantly related to child sleep problems above and beyond the effects of family-level income and control variables. I found support for this with the child weekday sleep duration outcome and the youth problem staying asleep outcome. And finally, for my second hypothesis, only one sleep outcome showed a significant interaction between family-level income and neighborhood-level poverty. However, further analyses were non-significant, so overall neighborhood-level poverty predicted sleep outcomes more consistently than the interaction between the two. Like any study, there are some important limitations to consider. Firstly, the low-income measure used in this study did not account for the cost of living in cities of families. For example, this might be important in considering the cost of living between, say, Toronto and a more rural town. Another important limitation is that the dissemination areas are geographically larger in rural spaces than urban spaces. Although future research is needed, the results of my study may suggest that relative poverty may not be playing a role in adverse sleep outcomes for children and youth. So children of lower income families living in higher income neighborhoods may be benefiting from the amenities in these neighborhoods that in turn promote better child sleep. This research may show the potential benefit of socioeconomic mixing in neighborhoods and the priority of investing in neighborhoods of higher concentrations of poverty to prevent health inequities for children living in them. Policies in Canada and Ontario currently emphasize the importance of mixed income communities. For example, Housing Now in Toronto is a housing initiative of developing affordable housing within mixed income communities, as well as the Housing Stability Action Plan by the City of London, Ontario. However, there seems to be a little bit of a mismatch between spending and the importance of these housing policies. From 2014 to 2019, only 3% of the Government of Ontario's annual expenditures were on housing programs for vulnerable populations. Given the importance of sleep problems as a performance indicator of overall health, my recommendations are that the Ontario government should prioritize spending on affordable housing, particularly in neighborhoods of higher concentrations of poverty, to prevent further inequities. My second recommendation is to prioritize investments into policies that aim to create socioeconomically diverse neighborhoods. Thank you for listening to my presentation today, and I look forward to answering your questions during the question period.